Hello everyone, 大家好. Today is 30th of December 2021. Today is our last talk of Chinese medicine dermatology. As I promised, I will have my last session before the new year. Now let's go to the lecture note. Today's topic is idiopathic hyperhidrosis and Raynaud's disease. During my 20-some years of practice, I've seen these two conditions and did help them with the problem. Chinese medicine can help to a certain level if the patients are willing to continue to take the herbs. Maybe we can even help more, but sometimes it's hard for patients to take herbs for the long term. Now let's look at the first condition, idiopathic hyperhidrosis. Normal sweating is caused by hot temperature, exercise, emotion, stress, eating hot food or spicy food, or when we have fever. Hyperhidrosis is abnormal increased sweating. In most cases, the cause of this is unknown. Some known causes include obesity, hormonal changes associated with menopause, illness associated with fever, such as infection or malaria, overactive thyroid gland, diabetes, and certain medications is related to the abnormal sweating. We call idiopathic hyperhidrosis. The reason for this, as we find so far, is not really clear. This phenomena happened when someone is a little child from very young or developed in the young adulthood. It can affect any parts of the body, but palms, sores, or the armpit are the most commonly affected area. The excessive sweating may occur even during cool weather, but it is worse during warm weather and when a person is under emotional stress. I had a young female patient can show me she has this sweating. She put a palm in front of me and then think some stressful thoughts, maybe uni exams and so, and then I can see the sweat came out from the palm and drip from the fingers. So I've met quite a few these kind of cases. I remember when I practiced less than a year, one day there was a tall, beautiful young woman walk in, search help for the sweaty hands. It was very hard for her job. She is the marketing manager for a company, but she needs to shake hands a lot with the clients or colleague, the people they at a meeting or something. But she feels so stressed and embarrassed when she shake hands, and her fingers are very cold, very wet. So that's one of the situation. Another young girl is, as I said before, a university student. She showed me how her palm can sweat, when she think about the exams or stressful event, and the hands just have so much sweat, and the sweat actually dropped from fingertips. So treatment options for excessive sweating nowadays is mainly follow the symptoms, like a reduced weight, medical management for the menopause, and some antiperspirant application, sprays, powders, roll-ons, and so on. you can find even surgery. They cut the nerves which connect to the sweating gland to stop the stop this sweating gland work appropriately. For Chinese medicine, we have noticed abnormal sweat and normal sweat for a long time. Normal sweat we call 自汗, spontaneous sweating, often accompanied by a versatile cold and tiredness. It's a yang deficiency symptom. This is, sorry, I said normal sweating. It's abnormal sweating. One type is 自汗. Another type is 盗汗. It's not night sweating. There were this kind of a record in the Chinese medicine literature more than 2,500 years ago. Night sweating often stops once wake up and accompanied by hot flush and a red face. Sometimes not always. It is an yin deficiency symptom. Foot and hand sweating is often related to the heart and spleen. That's in Chinese medicine concept. And as you all know, the heart and spleen is different from Western medicine, heart and spleen. Sweat is the liquid of heart. That's the Chinese medicine concept. When the heart qi is deficient, 精液, which is body fluid, cannot be controlled. Spleen controls the limb, and also spleen qi can make the liquid stay inside the vessel. When spleen qi is deficient, body fluid cannot be transported well. It will flow out as sweat. Sweaty hands and foot often affect people's quality of life. The symptom can be more severe when they need to focus, concentrate, and when they are nervous. Then how Chinese medicine identified abnormal sweating and what's the treatment methods. The first type is abnormal sweating due to heart qi deficiency. Other than the sweaty hands and foot, patients also feel nervous, tired, and palpitation. The face is pale, the tongue is pale with little coating, the pulse is thin and weak. The treatment principle is nourish heart, stop sweating. We know a very famous heart and shen nourishing formula called 天王补心丹. 甘麦大枣汤 is another one famous formula for 脏燥. So combine these two formula, we treat heart qi deficiency induced sweaty hands and foot. The ingredients are here. We can see mainly tonified qi, tonified blood, and stop sweating herbs like fu xiao mai, duan mu li. If the patient is very nervous, we can add 磁石, 珍珠母. They are shen calming herbs. And if the patient appears having palpitation, we can add 炙黄芪, 太子参, 人参. This is because mainly due to the heart qi deficiency. So abnormal hand and foot sweating is due to heart qi, but palpitation is another very obvious symptom of heart qi deficiency. So we can add some other ingredients to address that issue. Now, next one is spleen qi deficiency type. As we all know, spleen in charge of extremities, also in charge of qi transportation. So other than for spleen qi deficiency type, other than the sweaty hands and foot, patients often have cold hands and foot with pale or bluish color. Occasionally, there are some small blisters. The face appears withered and tired. patient also complains about poor appetite, irregular bowel movement. As we know, the spleen is in charge of digestive system. So when it has qi deficiency, it's oftenly have bowel movement problem. The tongue is pale with thin and thick coating. The pulse is deep and slippery. The treatment principle is tonify spleen and stop sweating. We choose the 平胃散 and the 理中汤 to modify. I put ingredients and the dosage here. You have a good look. I'm not going to read every ingredients because of the time. If the sweating is severe, we can use 补中益气汤 and add 乌梅五味子, make the qi tonifying function stronger. If the history is very long, we add 人参, we use 人参健脾丸 or 十全大补丸 to take for the long term. So patient take these pills for the long run, maybe the rest of the life until the problem's almost stopped. Now, external treatment, this one I have also used. The first one is simpler, only 2 herbs. I used this one with patient. Patient found they are very helpful, but can only stop sweaty hands for a period of time, and then the sweating will come back again. It's within a day, it will come back again. So it's like a temporarily stopping the symptom. And the other one, because it's the second formula is more complicated, so I didn't give patient, I didn't use it for patient myself, so I don't have the first-hand experience about this. This one seems like a bag. You rub it every now and then and will help with the problem. It's more symptomatic treated method, not to treat the root cause. Now, let's look at another disease. Again, it's often seen in the young woman. I've seen this kind of patient as well. Raynaud's disease, but in the Chinese medicine description and record, there's no exactly like a Western medicine stated 3 stages of Raynaud's disease. We'll look at the patterns later, what's recorded in Chinese medicine and what are the treatment. Now, I just briefly introduce what's Raynaud's disease. It is oftenly happened for female under 40 years of age. The exact cause is unknown. The phenomenon mainly is the cold and the purplish or very red fingers, toes. Some people have lips, nose, even tongue, cheeks, or other parts, chin, become like purple or dark red, or some with pretty bright red, but just abnormal compared to others. I leave the first stage, second stage, and third stage symptom for you to study. The Raynaud's episode can be triggered by cold, in cold winter, or patient when they touch the cold things in the winter especially, and then the fingers all of a sudden turn to really cold and dark purple, and also have ischemic pain, very painful, but can be released when you give them a hot mug of boiling water. When they touch the warm stuff, the symptom can be relieved. The cold weather, emotional stress, anxiety can play a role in development of this condition. With my patient, when I have few this kind of patient with different kind of severity came to see me. The first patient was a young, about 35 years old girl. I say, what's the reason for you to see me? It was summer. She was wearing a sandal, and then she pulled up her trousers, and then I was almost stopped breathe because all the toes and the back of the feet are blue. I've never seen this kind of skin. I was almost, hold my breath. I couldn't breathe. It's kind of a shock reaction because I've never seen this. But because I've learned this in the Chinese medicine dermatology, so I know what are the the reasons for this. Okay, in Chinese medicine record, the Chinese medicine classical literature record, we have a problem called extremity blue and purple syndrome. They didn't give a name of Raynaud. They gave a different name. It's more symptom describing name. There are different patterns relate to different reasons of this problem. The first pattern is yang deficiency of the spleen and kidney. So not all body yang deficiency, not all organs yang deficiency, but it's mainly spleen and kidney. Patient has persistent pallor and a freezing cold sensation in the limb, extending gradually with numbness and pain in the extremities. It's better in summer. In the mild case, you only see pallor extremity and then can turn to red, sometimes very red, and can start with pallor and gradually to the red, and later on leave the extremity like fingers or toes swollen. For severe cases, normally patient has very pale fingers, toes first, and then gradually develops cyanotic, including lips, nails, mainly nails and fingers, and lack of also accompanied of lack of strength in the lower back and knees. Patient also has a pale complexion, poor appetite, and loose stool. You won't see everything appear at the same time. The one I saw with bluish toes and skin at the back of the foot, his face is not that pale. Appetite is okay. Occasionally have loose stool, but not always. So when you see patient like this, you don't see everything, but the fingers and the skin is very, very abnormal. It's very different from everyone. So you can do your diagnose method, and identify if it's a yang deficiency type or it's another type. Okay, the tongue is pale with scant coating. The pulse is deep and thready. Treatment principle is warm spleen and kidney, expel coldness and free the network vessels. You can see the network vessels is affected by the yang deficiency caused internal cold. Prescription, we have a famous formula called 附子理中汤. 附子 is not allowed to use in Australia, so we use the rest of the 理中汤 to modify, mainly tonify the yang, tonify the qi belong to yang as well, and expel coldness and free the network vessels and reduce the purplish of the skin, the coldness of the finger, I use this yang deficiency formula, treated my patient. Eventually, this blue toe and the skin girl have like a light red, a pinkish skin, and she was very happy. She said, "That's okay." I said, "You're still a little bit redder than the normal people." She said, "That's okay. That's okay, not a problem." And later on, of course, as we can all understand, she came to see me for infertility. This again approved it's a kidney yang deficiency. At the end, she and her husband decide to adopt a child. Okay, now next type is qi and blood deficiency. This kind of patient has ice cold extremity with cyanosis. Tips of the fingers are thinner and stiff due to lack of blood, aversion to cold, lack of energy, shortness of breath, no desire to speak, a pale complexion, and occasionally stabbing pain in the skin. The tongue is pale with scanty coating. The pulse is deep, thready, and forceless. The treatment principle is augment qi and warm yang, nourish the blood and free the vessels. The formula we choose to modify is Yi Qi Yang Xue Tang. The meaning is benefit qi, nourished blood decoction. Of course, we have qi tonified, blood tonified, and moving herbs. And if you want to free the vessels, you need to use some vessel opening or unblocking herbs. For example, like Lu Lu Tong, Su Mu, Yan Hu Suo. Danshen is a kind of a blood circulation promoting herbs. And danshen, the good thing for danshen is it's not hot, warm in nature, not like taoren, honghua. When you make a formula, you have to look after the nature of the whole formula. Don't make it too warm or too cold. Too warm, if you take for a long run, it can cause other issues. Okay, the third type is invasion by external cold. It's obvious the cold from external, the patient has cold, numb, and painful extremities with a liking for warmness and a fear of cold. Warmth can elevate the symptom while exposure to cold resulting pallor or cyanosis, followed by flushing. That's the third type. The tongue is pale with a thin white coating. The pulse is thready and slow. The treatment principle is warm the channels, dissipate cold, because cold is from external, invigorate blood and free the vessel. The formula we choose is Dang Gui Si Ni Tang to modify. This is very formula written by Zhang Zhongjing in Shanghai Lun. We modify this and to achieve good result. In treatment of this problem, the main thing is ask patient to be patient. Give herself some time. Chinese medicine can certainly help. Myself helped patient with this condition. So I think you can help as well. The main thing is address or diagnose the problem. I used correct herb. Okay, today's talk is finished. I wish everyone a happy new year. I'll see you in year 2022. I'll start to talk about Chinese medicine diagnosis and treatment in mental illness in next year. Thank you for listening. Goodbye and Happy New Year again.